Welcome to your week-by-week pregnancy video series, brought to you by Ultrasound Dimensions, Medical and Maternity Ultrasound Centre.
Welcome to PregnancyChat.com and to week 28 of your pregnancy. I'm Monica Healy. This week typically marks the beginning of your third trimester. Although your bundle of joy appears to be fully developed, there are still a few more hurdles before the big day. Your second trimester symptoms will continue to linger on, and unfortunately many of them will magnify in the third trimester. Add symptoms such as Braxton Hicks contractions, leaky breasts as they begin to produce colostrum, and shortness of breath to the batch. What are Braxton Hicks contractions? From now until the end of your pregnancy, the uterus starts to practice contracting mildly in preparation for labor. These painless tightenings, called Braxton Hicks contractions, start at the top of your fundus and travel down the uterus, causing it to harden for about 30 seconds. It was the 19th century obstetrician John Braxton Hicks from St. Mary's Hospital in London who was the first to describe them. He realized that this painless activity toward the end of pregnancy was because the uterus needed to practice to contract strongly enough to be able to expel a baby through the birth canal and into the world at the time of birth. These contractions also help to direct more blood flow to the placenta during the last few weeks of pregnancy. Your breasts may feel fuller now due to the combined action of hormones preparing your breasts for lactation and breastfeeding. Although at times a little milk may squirt out unexpectedly, many women never see a drop of milk or colostrum before the baby is born. Colostrum is the early milk. It is a concentrated clear yellow secretion which provides your baby with all the water, proteins, and minerals required until proper milk is produced. Colostrum also contains high levels of maternal antibodies and also a substance with a natural antibiotic called lactoferrin, which helps fight infection. Shortness of breath may also happen in the third trimester. There are several reasons for this. High levels of progesterone increase your body temperature and your breathing rate. Your diaphragm has to stretch further and in the process becomes less flexible. This reduced movement forces you to breathe more deeply. Lastly, the expanding bump pushes abdominal contents up against the diaphragm, leaving the lungs with less room to expand. If lack of sleep persists, do not fight it. Instead, when that nighttime insomnia hits, take the time to relax, read a book, listen to soothing music, take a warm bath, or drink some chamomile tea. This might be your last chance to spend some me time before your baby arrives. The third trimester carries plenty of discomfort, but it also yields the joy and excitement of meeting your soon-to-be-born baby. The big day is fast approaching, and you'll likely be seeing your doctor every 2 weeks to monitor the baby's progress, although different centers have different protocols of when you'll see the doctor or midwife. Women who previously tested with an elevated glucose level will be given another 3-hour glucose test to test for gestational diabetes. As for women who have Rh negative blood, like myself, you'll receive an injection of an Rh immunoglobulin to prevent your baby from building antibodies. Rhesus is part of a blood group status. Your rhesus is either negative or positive. If you have an Rh negative blood group and your baby is Rh positive, then it's possible for you to form antibodies that will fight your baby's red blood cells. If you become pregnant again and your next baby is Rh positive, the antibodies you developed in this pregnancy can destroy your next baby's red blood cells, putting baby at risk for serious forms of anemia. Thanks to modern medicine, though, this is often quite rare because Rh negative moms are given an injection of an Rh immunoglobulin, which is completely safe and prevents the formation of these antibodies that attack your baby's blood cells. Your little one is packing on the fat and losing wrinkles and is about 1/3 of his estimated birth weight. He weighs in at a whopping 2.5 pounds, approximately 1.1 kilograms, and measures almost 15 inches, 38 centimeters from head to heel. This is a real-life model of your baby at 28 weeks. Baby fat is accumulating underneath his skin and his muscles are becoming well developed. Although he's almost done developing physically, mentally his brain is producing neurons by the second. Baby's also developing some scalp hair, especially on the back of the head. The network of nerves to his ears is now complete and he can hear more and more. Baby will also enjoy hearing your voice now, and so carry on talking and singing to him. The lungs are almost completely developed, which means that if your baby were born now, although it would be difficult, his lungs are capable of breathing air and he'd have a very high chance of survival. The umbilical cord is very strong and can withstand being squeezed and twisted by your baby. Babies are frequently seen during an ultrasound to grip their cord. Space in the uterus is becoming restricted due to your baby's increasing weight, but this means that he's becoming better acquainted with the various parts of his own body. And as he squirms, kicks, and practices that right hook to your uterus, he is also working on blinking and can even open his eyes for a period of time. That's right, this week your baby is mastering the art of the blink. He has begun experiencing REM, that's rapid eye movement sleep, so rest assured that even if you aren't sleeping, your baby is. Here are some tips for week 28. It's a good idea to test baby's movements. During the morning and in the evening, you should see whether you can feel at least 10 movements. If so, all is well. If not, convey this information to your doctor. You'll need to increase your calorie intake now by around 250 to 300 calories a day to meet the demands of your growing baby. You can easily achieve this by drinking an extra glass of milk and having a banana. To expel any excess fluids accumulating in your hands and feet, consume more water, avoid standing for long periods of time, wear loose clothing, and sit with your feet up when possible. Consistent swelling accompanied by dizziness, headache, and visual disturbances must be reported to your doctor immediately. So that's it for week 28. If you have any questions or comments, please join in the conversation in the forums at pregnancychat.com. I can't wait to tell you what is happening during week 29. Until then, enjoy this pregnancy journey. These are the precious moments our lives are made of. I'm Monica Healy, and thanks for watching.
Thank you for watching. If you're looking for a medical or maternity ultrasound scan, we can help. Since 2007, Ultrasound Dimensions has been trusted by over 31,000 patients and doctors. Our Enterprise Ireland award-winning team offers you convenient appointments, immediate results, and always takes the time to give you peace of mind. To schedule your appointment, contact us today.